Please.
I don't know where it fits, and it may not fit, or it may fit everywhere, in which case discard it or keep it in mind. But, and this is a comment, I don't know, intermediate between what, I'm sorry. This is I was saying, I don't know where this fits, and it may not fit at all, or it may be generally applicable. And it's just a little comment I wanted to make before, but I ran out of time. And it's sort of intermediate between what I think Debbie Chang had said about, not all the stuff is new, and what I guess Raphael was saying about some of the dysfunctionalities of local government, which is that a lot of these people don't keep track at all of the money they're currently spending. And I don't know where to put that in, but and you have rules theoretically in place. GASB 34 requires life cycle accounting. I don't know any municipality really that does it in a serious way. But if you did that, a lot of those trades, barters, et cetera, across different regions of government would be a lot easier to make.
Yeah, it's an excellent point. And so there's more to this story than what are the structures through which capital can flow differently. There's also the processes that may catalyze people to think differently and to be willing to break from business as usual. And I think you're naming a good one there, is the more that we can endogenize the costs and be more transparent in the accounting, then suddenly there become enormous opportunities. I think one of the links in here is the chapter from the recent Stakeholder Health book, and Gary Gunderson was on the planning committee to speak about changes in accounting, just the sheer accounting practices that make it really hard to invest in co-benefit. And with modified rules on accounting, suddenly the incentives for what can be seen as unusual investments from an institutional perspective seem a whole lot less risky and much more strategically imperative. We've also seen this in accountable care organizations and these proto-accountable communities for health, as they start recognizing that that the insurance side of the house and the delivery care side of the house are not actually disconnected. In fact, changes in delivery can lower costs to the insurer, and self-insured employers become one of the logical places where it's all their money. And if you could deliver the care more cheaply and invest more effectively in population health well-being, you end up with a very virtuous cycle and quite a bit of capital to unlock. Sort of as you put, the latent value in this system is enormous. The question is, how do you make it visible, and then sort of the arrangements to make it a routine flow. Those are still hard questions for us as a field, but I think they're the right questions.
So, George Isham, for the people on the web. So this is just very, very helpful, Bobby, as usual. I mean, very, very helpful. But it's financing structures, and I think the other thing that occurs to me as I begin to think about just looking at it as we're talking here is that who the actor is that employs the structure becomes critical.
Yeah.
And then there's also, if you do that, then there's also an opportunity to really think, come back and do it again, and ask yourself whether you've characterized the structures as fully as you might, given the deep knowledge that might exist elsewhere about some of those existing structures. So I'm thinking about the meeting at the Harvard Business School with respect to business that Alina and Darla and I attended on behalf of the roundtable, and that model that Michael Porter offers. And I think I can see it. I think I can see the components in here. But as I heard you talk down the components, number 10, for example, I think he has a more robust kind of concept of the potential for businesses to align business models and make profits, and also create community value in a more robust and sort of way than we typically think about it from a public health perspective. So I hope that's a useful comment, because I really think this is a tremendous bit of intellectual summarization and work here for us.
It's a good point about who are the parties to these kinds of arrangements, and there is a sort of social history around all of these. And I think when they work well, it's usually a cast of characters who are seeing some synergy together. And I think it might be fair to say that the solutions that lead to a more interdependent health economy are ones where actors see that there's a potential to generate greater value, but they generally can't do it alone. And so we see bridges between healthcare delivery and social services and the synergy that can come from that. Obviously, that there's upstream investments that can lessen the demand for scarce and expensive health care, that can actually prevent the building of another wing for diabetes care. Lots of hospitals don't want to go through the capital campaign to build that extra sort of tertiary care infrastructure if it can be better averted through a population health investment. That is a choice that many regions can face, and how they reckon that choice can matter. So you're absolutely right that we could flesh this out, and we have draft versions that really turn this into a typology with 6 or 7 other columns that talk about who would need to be involved and what are some of the major pitfalls and momentum builders that allow it to happen. Is exactly the right question.
And just to add to that the thought, I think again about the process that we went through with the report that Martha Gold co-chaired with Steve Teutsch, a couple of years ago, where in part of that third report, we actually took a good look at mechanisms for funding governmental public health.
Right.
And you were there too. Yeah, that's of course why he's prompting me. There's a richness to that sort of analysis by type of funding. Anyway, I made my
well
point.
said. Well said. Sandy.
So, Bobby, you had started off by talking about that we rarely talked about or were trained in waste reduction. And we just heard, surprisingly, that clean energy has estimated 50% waste, which even exceeds the 30% estimated for healthcare. As you think about taking waste out of the system, is it just in number 7 that's kind of the model for, or are there other places across this financing structures that you would see taking waste out as a way to finance?
Oh, I think the 2 principal sources of economic benefit are generating value and eliminating waste. And to some degree, any investment could be one or both of those. So there are lots of grant programs that are designed to achieve greater efficiency. They don't go so far as to play out the story of what happens when you achieve that efficiency. Are you going to make a formal agreement about what to do with those savings? So I'll just confess, a pet peeve of mine is reading articles. It's hard to pick up a journal article that doesn't say we saved X, Y, and Z amount of money through A, B, and C initiatives. And the story stops there as though that's the punchline, when the questions really ought to be, and so what happened with that money and who got to decide, and is that really the most that could be achieved? I mean, what were your goals with that effort? It wasn't just a matter of marginal improvement through a short-term action, or it ought not to have been just a marginal improvement and a short-term investment. It's really a question of progressively greater ability to unlock that potential. And so we haven't talked about it very much today, but there's an important question about how are we financing the agenda of a population health and the multi-sector goals, but are we financing it up to the level of need and potential, right? And so we've repeatedly called to the need for benchmarks for investment. And I think one of the poll questions at the beginning of the day behind the quest for new mechanisms and political will was this idea of benchmarks for investment. And I think that would go a long way to saying how do we get there through greater efficiency and greater value.
So I'm Bridget Kelly from the Creating Health Collaborative, and I'm picking up on what you just said about who gets to decide, and also on the inclusive financing that Holmes was talking about. Because I'm thinking about how the people who bear the greatest burden and the greatest cost from how our spending is now allocated are the people with the poorest health, and they tend to have very little voice whatsoever in this process of financing.
Right.
And I'm wondering where some version of the inclusive financing principle fits into these, or maybe across many of them.
Yeah, that's one of those dimensions that would cut across all. And you could, for example, implement a grant program through sincere, authentic community co-design, or you can do it in the worst top-down solution possible. And same for, you can negotiate a gain-sharing agreement. A lot of ACOs have done this, where billions of dollars are now recirculating without full transparency of who's a party to that deal, and was that really the right way to use that money? That's particularly a tricky question because healthcare cost savings are a reflection of a large cast of characters who have to cooperate in making that happen. You know, different roles for many health professionals, but also families and you know, folks way outside the clinical space. And so if their actions were important in delivering that ultimate reduction, it's a fair question, why not expand these deals to have a more sort of complete conversation about exactly how to best use these assets. For sure it would be contested, but probably not a paralyzing thing as we've seen in the justice space where even crossing ideological divides, the pragmatism of, hey, saving spending and keeping people out of prison is a net good, and I think many people would say keeping themselves out of the hospital is an equivalent good. And so you're exactly right that any one of these things can be done with greater or less democratic, sort of integrity. Thank you. I'm thinking we probably should end here for clarification purposes and direct our attentions to, these are excellent questions. They're probably good questions to ask of one another. So let me turn back to Chris and he can explain the exercise. Thank you.